Obesity is a chronic disease, and currently we are in obesity epidemic. It is affecting pretty much a quarter of the population, or up to 30% with obesity, and nearly 55% of our population currently either overweight or obese. Obesity is where there is excess accumulation of fat in the body, resulting in multiple other diseases or comorbidities, and not a single organ of the body is spared by the effects of the obesity. From head to toe, one can look in how it affects. But if you, as a simple mnemonic, if you just remember M, like a mental illness, a lot of patients with obesity have anxiety, depression, or a mixture of them, or even major psychosis. In addition to that, people who have mental illness take medications, and that can lead to obesity as well. So there is a relation between mental illness and obesity. However, currently one of the most worrying thing is the metabolic consequences of obesity. The key is, we know, diabetes, type 2 diabetes, where the body is not producing enough insulin, or even though the body produces enough insulin, it is not metabolized in the tissues of the body, called the insulin resistance. And we all know very clearly diabetes can affect to your heart, to your kidneys, to your eye, and even lead to limb amputation. In addition to diabetes, obesity can cause hypertension, high cholesterol in a mixture of them called as metabolic syndrome. It also leads to what we call the fatty liver. Currently, the non-alcoholic fatty liver disease, or the doctor or physicians call it NAFLD, is the leading cause of liver failure, more than that of alcoholic liver disease, and which many of the clinicians feel this is underreported and underdiagnosed. The third M is mechanical effects of obesity. Patients with a 50 BMI, pretty much, because our normal BMI is 25, they may be carrying their own weight all the time. So this has an impact. The overweight and obesity have an effect on the back, the hips, the knee, the foot, and that also limits the mobility, and which leads to further obesity, because they cannot do the exercise or the activity we need to do maintain our ideal body weight. And moreover, because of this epidemic of obesity over the last 50 years, people have started following these patients with obesity with regards to malignancy. And studies have shown that obesity increases your risk of cancer, more so in female with regards to uterine cancer, breast cancer, and ovarian cancer. In men also, it also increases risk of colon cancer, esophageal cancer, and kidney cancer. And studies have started showing that by reducing weight, your cancer risk reduction is also reduced. Now, in addition to that, obesity reduces the job you want to go ahead. So there's a direct and indirect cost to the individual as well as to the economy. And people have looked into, in UK, the cost of obesity could be up to 15 billions to our economy. So obesity is a chronic disease, and it affects pretty much all the organs of the body. So the key message is active living and healthy eating. And if you're obese, you need to take all the care, see your practitioner and see a specialist, so that you can get the right and appropriate way to tackle your obesity.